All right, welcome back. This is Health Matters with me, Dishen, Kumar, and today's topic we're talking about the communication aspect of a doctor's daily life. When talking about patients' data, talking about patients' information, what doctors can actually do to improve or protect patient data while communicating with other doctors in hospitals when they are actually working and things like that. So with me today we have Dr Ezam Ali, who is the CEO and founder of MedPlanner Sdn Bhd. Thank you, doctor, for joining us today.
Welcome.
And let's start off with something that your company has created, an app that is designed to help doctors called Circles.MD, correct? So can you explain a bit more about that app?
Okay, so Circles.MD is basically a secure clinical messaging app for everyday patient management. The whole idea is that doctors can communicate discussing patients on daily basis when they manage patients. Instead of using social instant messaging, they have a dedicated messaging app which only healthcare professionals are a member of, with the ultimate aim to improve patient care.
Now, talking about the healthcare community and things like that, how is it important in protecting that patient data? Because that was one of the biggest issues with social messaging apps is a photo that's been shared or some information that's been shared can be forwarded to anybody else. So there's not much of protection. So what does Circles.MD change in that sense?
Okay, so our security features, for example, are to do with the infrastructure and how we've designed it. When I mention infrastructure, it's basically the digital health standards to protect patient health information. So digital health standards, for example, are HIPAA compliance and ISO 27001 compliance. Okay. In terms of the actual experience of the doctors using the app, how we make it secure, for example, it's not possible for them to forward messages. Okay. And the other thing is a closed network. Everyone is a healthcare professionals. And every single case is by invitation only. Okay, so each case will be only discussed with members of the clinical team that has been created for the team leader. And other security functions, for example, every single clinical photo or clinical images, for example, is taken from within the app. Okay. So this is one of the requirements for digital health standards. You must not store any patient data on the phone. And this is different, as we know, with social messaging apps, unless you really go through the privacy and security settings. But with this app, you upload the app, and then you take a picture. And the picture will be stored in the cloud. Okay? Again, the cloud security is approved and met the standards for HIPAA and ISO 27001.
Yeah. Let's talk about, we've talked about patients, protecting data and things like that. What about the benefits to the users, the clinicians? What does Circles.MD provide for them?
Okay, so although the ultimate aim of this app is to benefit patient care, expedite their care, but the immediate benefit is actually to the users. Users here being the healthcare professionals. Okay, the benefits as we have developed this for, because this is developed by clinicians, for clinicians. Okay, so the benefits, for example, is it will be easier for them to work smarter. Okay, work smarter because the app has been designed for clinical working. So, for example, if they want to refer patients, if they want to ask for specialist advice or hand over patients, we have features for that. Okay, this is is very unique as an app for messaging in itself. Okay, for example, in Circles.MD, you have you can create a clinical team. Okay, and then another clinical team looking after the same patient. These two teams can have a common discussion. Okay. So what I like to do is to come back to the this asking for a specialist advice feature. Junior doctors especially say to me that when they ask for specialist advice, it can be quite nerve-wracking for them. Okay? And when you look at research done on clinical messaging, something like this app is a great way to break down the hierarchical barrier between specialists and junior doctors. So you formalize the referral process. So because you're formalizing the referral process, the activity can happen quicker to get advice from specialists, for example. So there's benefits for the users in terms of clinical, how they can work smarter. But also, which I haven't touched in any of the during this interview at all, is that we also have other features, okay, for learning and growth and for networking. So we have a feature called Buletin. Okay, so where doctors can actually subscribe to specific medical bulletins that interest them.
Oh wow, okay.
Yeah.
So you have information coming into the app as well?
Yes,
okay.
yes, and they also can publish something from their team. If you have a cardiology team from a hospital here, if you want others to know about it, say if you've achieved something or there's a latest guideline, you can publish it where others can subscribe to it.
Interesting, interesting. And talking about networking, you were saying?
Yes, so networking, doctors can create teams of network. For example, say in Klang Valley.
Okay.
So if they create a team of network where doctors in general medicine, for example, will have a network of where they can refer. Okay, so they can build that.
Okay,
so for example, if they want to refer to a liver specialist or neuro specialist, they can have all of that created as a network of referral, for example, where they can work more efficiently. Yeah. It can also work as a peer support for junior doctors. We hear a lot of things about junior doctors working too hard, junior doctors requiring a lot of support. These are all true, and they can support each other through this app using one of the feature for peer support, which is the chat feature.